Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Miscarriage. Introduction. A miscarriage is usually described as the loss of a pregnancy from natural causes before the 20th week of pregnancy. Most miscarriages happen very early in the pregnancy, often before women even know they are pregnant. There are many different causes for miscarriage. In most cases, there is nothing you can do to prevent one. This program explains miscarriage. It also discusses its causes, symptoms, and treatment. The female reproductive system. This section talks about the female reproductive organs. These organs are in the pelvis. They are found between the bladder and the rectum. The female reproductive organs are the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The ovary releases an egg. The egg goes down the fallopian tube to the uterus. It can become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to grow a lot. The lowest part of the uterus is called the cervix. It opens into the vagina. The vagina is also called the birth canal. It opens to the outside of the body, between the urinary bladder opening and the rectum. Pregnancy. During pregnancy, the fetus floats in a special fluid. This is called amniotic fluid. Both the fetus and the amniotic fluid are in a bag called the amniotic sac. The fetus gets nutrients from the placenta. It is attached to the inside of the uterus. The placenta grows with the fetus during pregnancy. The mother's blood enters the placenta. It brings oxygen and nutrients to the fetal blood. The mother's blood also picks up waste from the fetal blood. The umbilical cord allows the fetal blood to travel from the fetus to the placenta. The mother's blood does not go into the fetus. It is kept separate. When it is almost time for delivery, the head of the fetus drops down into the mother's pelvis. This causes the mother's belly to look slightly smaller. This is called lightening.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Miscarriage. Miscarriage is also known as spontaneous abortion. These terms mean that the pregnancy ends naturally before 20 weeks. Miscarriages are common. For every 10 pregnancies that women know about, 1 or 2 usually end in miscarriage. On top of that, many pregnancies end before the woman even realizes that she is pregnant. Vaginal bleeding happens in about half of all pregnancies. It can be a sign of miscarriage, but many women who have vaginal bleeding go on to have healthy deliveries. The tissues inside the uterus are referred to as products of conception. These include the fetus and placenta. A complete miscarriage means that all the products of conception have left the woman's body. An incomplete miscarriage means that some tissue remains inside the body. Causes. Most miscarriages happen because the fetus isn't developing normally. There are many different causes for miscarriage. In most cases, there is nothing you can do to prevent one. Factors that may contribute to miscarriage include a genetic problem with the fetus, problems with the uterus or cervix, hormone imbalances, blood clotting problems, polycystic ovary syndrome. Sometimes a woman and her baby have incompatible blood types. If a blood sample shows that you are Rh factor negative, you will be given medication. This is to prevent a possible blood type interaction with the baby if the baby is Rh positive. Problems with the mother's health may lead to miscarriage. These include an infection, diabetes, kidney or thyroid disease, lupus. Substance abuse, including the use of tobacco, alcohol, and drugs, increase the risk of miscarriage. Invasive prenatal tests also increase a woman's risk. But exercise, straining, and sex do not lead to miscarriage. Women older than 35 years of age have a higher risk of miscarriage. Some studies also show that the chance of miscarriage is higher if a woman's male partner is age 35 or older. The risk of miscarriage is higher in women with a history of more than one previous miscarriage. In the vast majority of cases, there's nothing you can do to prevent a miscarriage. If you're concerned about early miscarriage, focus on taking good care of yourself and your baby. Seek regular prenatal care, manage any chronic conditions, and avoid known risk factors for miscarriage. Symptoms. Signs of miscarriage can include vaginal spotting or bleeding, fluid or tissue coming out of the vagina, cramping or pain in the belly or low back, weakness or dizziness, nausea or vomiting, burning or pain when urinating. Although vaginal bleeding is a common symptom of miscarriage, many women have spotting early in their pregnancy but do not miscarry. But if you are pregnant and have bleeding or spotting, contact your healthcare provider right away. You may bring any tissue that is passed into your healthcare provider's office in a clean container. It's unlikely that testing would show a cause, but it can confirm if the placenta has been passed. If so, your symptoms are not related to a tubal pregnancy, also known as an ectopic pregnancy. Sometimes a woman may have a miscarriage along with an infection in the uterus. This is called septic miscarriage. Signs and symptoms include fever, chills, body aches, thick, foul-smelling vaginal discharge. Diagnosis. An ultrasound will allow your healthcare provider to listen for a fetal heartbeat and ensure normal development. The healthcare provider may put gloved fingers in the vagina and feel the abdomen with the other hand. If you've miscarried, a blood or urine test can measure the level of pregnancy hormone in your system. This can tell if you've completely passed all placental tissue. The healthcare provider may use a speculum to look at the cervix. This is a plastic or metal device that goes into the vagina and holds it open. He or she may use gauze or a clamp to remove excess blood or clots. This may be uncomfortable for some people. Treatment. If you are having a miscarriage, one option is to let your body get rid of the products of conception naturally. This is called expectant management. It could take up to 3 or 4 weeks. Medication can speed up the process. For most women, medication works within 24 hours. Surgical management involves dilating your cervix and removing the tissue. This is called dilation and curettage, or D&C. It may take a few hours or days to recover physically. It can take longer to recover emotionally. Give yourself time to grieve. Counseling is an option if you are struggling with the loss. Call your healthcare provider if you have fever, chills, heavy bleeding, or severe pain. These signs and symptoms could indicate an infection. Do not have sex, use a tampon, or douche for 2 weeks. You will have your period again within 6 weeks. Pregnancy can happen as soon as the first cycle. Your healthcare provider may recommend waiting at least 1 menstrual cycle, if not longer, to become pregnant again. Wait until you and your partner are ready, physically and emotionally. If you have 3 miscarriages in a row, you may consider getting tested for problems. In some cases, your healthcare provider may suggest testing after 2 consecutive losses. But 2 losses are often due to chance and not to an underlying medical cause. Many women who have a miscarriage go on to have healthy babies.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A miscarriage is usually described as the loss of pregnancy from natural causes before the 20th week of pregnancy. Most miscarriages happen very early in the pregnancy, often before women even know they are pregnant. There are many different causes for miscarriage. In most cases, there is nothing you can do to prevent one. Signs of miscarriage can include vaginal spotting or bleeding, fluid or tissue coming out of the vagina, cramping or pain in the belly or low back, weakness or dizziness, nausea or vomiting, burning or pain when urinating. It may take a few hours or days to recover physically. It can take longer to recover emotionally. Give yourself time to grieve. Counseling is an option if you are struggling with the loss. If you do decide to try again, work closely with your healthcare provider to lower the risks. Many women who have a miscarriage go on to have healthy babies. Thank you for using Explain.